Surgical Instruments Part 1. 1. Rampley's Swab Holding Forceps. Uses. Used for cleansing the skin with swab dipped in antiseptic solution during all operations. It is used for removing the laminated membrane and the daughter cysts during operation of hydatid cyst. Used for holding a swab which is used to clean the blood during dissection of Calit's triangle during cholecystectomy. This may be used to swab an abscess cavity. This may be used to hold the fundus in Hartmann's pouch of the gall bladder during cholecystectomy. This may be used as ovum forceps. 2. Hemostatic forceps. Uses. It is used during all operations. It is used to hold bleeding vessels while cutting through different layers of tissues. May be used as a dressing forceps. May be used to tie a knot after suturing. It may be used to dissect the vein while doing venesection in the arm, basilic or cephali vein, or in the leg, great saphenous vein. While doing intestinal resection and anastomosis, the mesenteric vessels are held in between hemostatic forceps and the desired line of mesentery is divided. 3. Coker's hemostatic forceps. Uses. Used during appendicectomy operation to crush the base of appendix. Used to hold perforating vessels during mastectomy. Used to hold the meniscus during meniscectomy. During subtotal thyroidectomy, a series of Coker's hemostatic forceps are applied around the margin of thyroid gland lobe before excision of the enlarged thyroid lobe. Used to hold bleeding vessels while operating on palm and sole. Used for holding vessels in the scalp while raising a skin flap for craniotomy. Used in obstetrics for artificial rupture of membrane. 4. Alice, tissue forceps. Uses. Used to hold the neck of the bladder during bladder neck resection. Used during thyroid operations, neck dissection to hold the margins of the skin while raising skin flaps. Used to hold the skin flaps while excising a lipoma, sebaceous cyst or lymph node. Used to hold the skin margins during incisional hernia operations to raise the skin flaps. May be used to hold the margins of the fascial gap while dissecting the hernial sac. 5. Babcock's tissue forceps. Uses. Used during gastrostomy or jejunostomy to hold the gut while applying purse string suture. Used during gastrectomy, gastrojejunostomy to hold the margins of the stomach while applying an occlusion clamp. Used during appendicectomy. Usually 3 pairs of Babcock's forceps are required during appendicectomy. 1 pair holds the appendix near its tip, 1 pair holds the body of the appendix and the 3rd pair holds the base of the appendix. Used to hold the cut margins of the bladder during transvesical prostatectomy or suprapubic cystolithotomy. 6. Lane's, tissue forceps. Uses. During mastectomy it may be used to hold the breast while dissecting it off from the pectoral fascia. Used during submandibular or parotid gland excision to hold the gland during dissection from the adjacent structures. May be used to fix the draping sheets and also to fix the suction tube and the diathermy cable to the draping sheets as an alternative to towel clip. 7. Plain dissecting forceps. Uses. Used during almost all operations to hold delicate structures like peritoneum, vessels, nerves and muscles during dissection and suturing. Used to hold blood vessels, nerves during dissection. Used in pediatric patient to hold the delicate structures during suturing. Used during hernia operation to hold the hernial sac during dissection of the sac from the cord structures. Fine-tipped forceps is used during nerve repair and vascular anastomosis. 8. Toothed dissecting forceps. Uses. Used during almost all operations to hold tough structures like skin, fascia and aponeurosis. Used to hold the cut skin margins during suturing. Used to hold the linea alba or the rectus sheath during closure of abdominal incision. Used to hold the scalp during closure of scalp incision. Fine-tipped tooth dissecting forceps is used to hold the cut margins of the prepuce for suturing during circumcision. 9. Mayo's scissors. Uses. Used for cutting sutures. May be used to cut dressings. May be used to cut a corrugated rubber sheet drain. Used during appendicectomy to split the internal oblique and transversus abdominis muscle. After incising the external oblique aponeurosis, the scissors is thrust through the internal oblique and transversus abdominis muscle with the blades in closed position, and then the blades are opened up and the muscles are thus split up. Used to cut tough structures like linea alba, external oblique aponeurosis, anterior and posterior rectus sheath during entry into the abdomen by a midline, perimedian or subcostal incision. 10. Heath's suture cutting scissors. Uses. This is used to cut the sutures on the skin or mucosal surface. The serration at the tip of the blade helps in holding of the suture during removal.